friends are going to take over from here and explain you a bit more about the X-rays in detail.
Hi everyone, I'm Maisarah. Hopefully you guys are still here, alive and well. So I'll proceed with the components of X-ray machine. I believe that each one of you has at least encountered this X-ray machine, right? But I'm sure not everyone knows or notice what makes up or what are the main components of the X-ray machine, right? So today I will briefly explain to you some of the main components of the X-ray machine. So we have the first one, which is the X-ray tube. This is actually the heart of the X-ray machine because this is where the X-ray is originated and where it is produced. I will explain to you how it is produced in the next slide. Siti, can you? Okay, you can refer to this slide. So imagine that you have two filaments, cathode and anode. So imagine that this is cathode. So we know that every filament has surface electrons on it, right? And electrons, when given enough energy, it will break free from their bonds. So we will apply this concept to this cathode. So we supply the cathode or the filament with enough current or low voltage current to make sure that the cathode is heat up. So the surface electrons will gain energy. So when the electrons gain energy, so this electron will feel, oh, I have enough energy already, I can travel. So they will break free from their cathode surface and travel from cathode to anode. They just decided to go to the anode. Okay, so they move in a straight line and then strike the anode at a focal point. They will not scatter because we have focused it using the collimator. So when these high energy electrons move to the anode and strikes it, it will interact with the atomic particles of the anode and produce X-ray. So basically, X-ray is generated from the interaction of the high energy electrons with the atomic particles of the anode. Okay, previous slide please, Siti. Second component of X-ray machine is the high voltage generator. If you notice, I have mentioned that the X-ray, that the electron will travel from cathode to anode, right? So during the traveling time, we will supply it with high voltage to make sure that the electron has more and more energy and will move vigorously, increase its speed to strike the atom with more impact. This is highly important because the strikes of the high energy electrons to the anode will determine the penetration level of the X-ray radiation to the patient's body and also the clarity of the image to be produced later. The third one is the cooling system. So can you guys guess why is this cooling system important? If you know, you can comment in the chat box. And for those who don't know, it's okay, I will explain. So like I have mentioned too, this electron has a very high energy, right? So however, this high energy, not all of them will be converted into photons and make X-ray radiation. Only 1% will be converted into photons actually. The rest, the 99% will be converted into heat. And this heat is useless, it is very nuisance because it will cause the anode to heat up really fast and it will cause the anode to burn up or melt. So we don't want this condition to happen. So we supply the cooling system to the anode to make sure that the anode is within an appropriate temperature range. Clear? So the fourth one is the control console. This control will control all the parameters involved in X-ray machine. For example, it will control the amount of current supplied to the X-ray tube. It will control the voltage supplied to the electrons, and also it will control the amount of time that the patient will be exposed to this X-ray radiation. So next, I will show you a simple setup of the X-ray. So I have mentioned before the four main components you can see here with the addition of a photograph bed and the Baki stand depending on which position is appropriate for the patient to undergo their diagnosis. Next. Okay, here is the procedure of X-ray. I will let you watch this video first before I conclude some important points. So happy watching.
In the X-ray, the MIT will have you standing, sitting, or lying down. In the X-ray room, there's a legal MIT will have you stand and only X-ray the part requested by your doctor. In the X-ray room, the MIT will have you standing, sitting, or lying down. It is a legal requirement that we can only X-ray the part requested by your doctor. The MIT will feel for your bones to ensure that we are X-raying the right area. We will then go behind the lead wall to take the picture. The X-rays are invisible and you won't feel them. The machine will beep when we take the picture, and it is very important to keep very still so that we can get the best picture possible. Some X-rays can be taken with the machine moving around you, like this one of your teeth. Some procedures can be taken like a video by one of our radiologists. They are doctors that specialize in reading X-rays and scans. These videos see movement inside you, and this is called fluoroscopy. Sometimes we will give you special drinks or injections that show us different parts of your body, but your appointment letter will tell you if this is going to happen.
Okay, so I would like to stress 2 points mentioned in the video. The first one is that you have to stay still throughout the whole procedure of X-ray. This is to reduce artifacts movement caused by our movement. So these artifacts will reduce the quality of the image actually. So next time, if you need to undergo X-ray diagnosis, make sure that you stay still, you lie down still, and you stand still in the X-ray procedure, okay? So the second one is the use of contrast agent. Usually, we will use iodine-based contrast agent, and it will be injected into our body to increase the contrast between, per se, we want to image the intestine. So we would like to contrast it than other parts of the body. So next. As you can see here, it is the radiographic densities of the X-ray. There are like 5 spectrums, main spectrums of the grayscale image. So as you can see, the air has the blackest and darkest color because it is very translucent and it has nothing to absorb the X-ray and to block the X-ray from penetrating. Whereas the metal and the bone, it has very great absorbent, and it will absorb this X-ray and block it from penetrating further. So it will appear very white in the X-ray image. So I hope you understand what I explained, and I will pass to my friend to explain further. Thank you.
So this slide illustrates the difference between the low and high contrast image. You can see the high contrast image in the right and low contrast image in the left. And like my friend explained before, you can see here is the black area, white area. The black area is the ear and the white area is the bone. And the other gray area content would be fat and the liquid, etc. Next. So this slide will explain the X-ray result of the different part of the body. The first one would be the abdominal X-ray. So this is the X-ray of your abdominal cavity. It will contain your stomach, liver, etc. So usually it is done to explain or to diagnose unexplained pain you feel in the abdominal area. And the second X-ray, second picture is of intestine X-ray. So usually for this X-ray, special liquid called barium liquid is usually the radiologist tell you to drink that, and for that will appear white here. You can see the white line. That's your GI or gastrointestinal tract, and this is for the barium. So it is done to diagnose tumor ulcer of your GI tract. The third one is of hand X-ray. So you can see all the bone of the X-ray, that is white, and the other gray area would be fat, skin, etc. So if there is any fracture, it can be easily seen here. The fourth one is the skull of the X-ray. So all you can see here is the bony part. That's the bone of your skull. And the fifth one would be the chest of your X-ray chest. So usually this is of a normal chest. So there's other abnormal condition. Doctor or radiologist look for the abnormal condition in your chest. So you can see all the black areas, the air. You can see the heart. You can see the bone, which would be um, of white color. Uh, the next one is the X-ray of your teeth. So you can see there is a white color in the teeth. That would be the metal, like my friend explained before. So usually dental X-ray is done. Doctor usually see to check the condition of your decay of your teeth. So doctor first see like if he can save your teeth uh, by root canal or not. If the X-ray show that your teeth condition is very bad, then it have to remove surgically. The next picture is of the knee joint X-ray. You can see here the bone part and the skin fat. And the last image is of thoracic spine. That actually this image is of your whole spine. I can see here. Uh, next slide. So this slide will explain the difference between normal and pneumonia chest. You can see the normal chest is this, normal chest is this. This is very clearly seen all the area. Usually in the abnormal or pneumonia chest, what you expect to see? You expect to see like more thing, but for the pneumonia chest, actually it's not. What the radiologist want to see from a pneumonia chest is the loss of the area. So in this image, you can see this the loss of the border of the heart here. Look from the left image, there is the heart is clearly seen, but the right image, the border of the heart is not clearly seen. So this is very early stage of the pneumonia. So if the stage is very severe, then the other dark side, the air won't be seen clearly through. So in case of COVID-19, this is very important. That will be explained in the later slides, because in COVID-19 also the pneumonia is very severe. That's one of the early diagnosis. You say like they check your heart for the like there is any pneumonia or not. So that's all for me. Next.
Hi and Assalamualaikum everyone. I am Shakira. So I hope you guys are doing great wherever you are. So thank you again for being here today with us. So since everyone must have experience of getting the X-ray, so my last time was I think during the medical checkup for entering this VTR. So if you guys notice, there is a caution sign in the X-ray room. This sign is indicates that the use of radiation in X-ray. So the radiation is one of the restrictions of the X-ray, but it is used for everyone because the radiation dose is kept as low as possible. However, due to the use of radiation, there are some precautions that we should take when handling with certain cases, such as pregnancy and also for X-ray for the children. Other than that, there is certain X-ray examination which we need to use contrast agent. Contrast agent is, as explained by my friend Anis, it is used to improve the pictures of certain organs. However, we need to bear in mind that certain people they might be getting allergic effects after the use of this contrast agents. But if you guys get any of these side effects, you don't need to be worried. It's just one of the allergic effects. And but if it keep on continue, then you may need to refer to the doctor. Okay, next slide. Okay. X-ray It is very essential in COVID-19 for both diagnosing and also follow-up. So for today's talk, we have interviewed Mr. Wan Arifin, a radiographer at Medini Clinical Hospital. He has 12 years experience in this field. So let us watch what he said about the significance of X-ray for COVID-19.
Apa peranan ataupun penglibatan X-ray dalam situasi pandemik COVID-19 sekarang?
Yang pertama sekali, kita berperanan sebagai one of the earliest screener lah. Faham tak earliest screener tu?
Faham.
One of the langkah awal untuk kita detect COVID. Contohnya kalau ada pesakit, dia mengalami simptom tapi kita tak tahu dia batuk ke tak, kita tak tahu dia positif ke tak positif, dia akan pergi swab dulu, betul? Sebelum dia dapat result, kita akan buatkan dia X-ray. Okey? Sebagai peranan imaging department X-ray, kita support dia orang dari segi one of the earliest screening lah. Contohnya patient tu positif kan, so, lung condition dia macam mana, so kita akan pergi buat X-ray lah. So in case kalau tiba-tiba dia positif, ada pula pneumonia, itu kita akan ambil berat sikit lah sebab dia secondary disease kan. X-ray yang dia ambil tu, sama ada patient ni kebahayaan dia, patient ni, the mortality rate dia tu tinggi tak kalau dia ada COVID. Selain daripada itu, kalau katakanlah dia tak ada COVID tapi ada disease dekat lung dia lah, contohnya standard orang batuk pneumonia kan, so mungkin grade dia kita lebih rendah lah, dia punya risiko dia untuk meninggal kan. Tapi kalau dia COVID positif and then dia ada pneumonia, itu perawatan awal perlu disegerakan lah. Bukan kita nak cakap dia kadar kematian dia lah, cuma dekat mana dia infection tu berada, dekat stage mana infection tu berada. Kalau macam kita ambil X-ray kan, so dekat lung dia, berapa complicated kah pneumonia dia, sama ada simple pneumonia, intermediate pneumonia ataupun bronchopneumonia yang biasa. Begitulah. Daripada tahap sakit tu, daripada X-ray yang kita ambil, kita boleh grade dia. Jadi kalau dia ada pneumonia associated with COVID, lain tindakan itu. Dia macam bukan kabut sikit lah kan, cepat. Kalau dia negatif COVID with pneumonia, itu kita lag lah.
Okay, so how was the interview? So I really hope that you guys now get the ideas of why X-ray is important to COVID-19. Okay, so I think let me conclude and summarize some of important points from the interview. So basically, X-ray is one of the earliest screening to determine the patient severity. The patients will be categorized by their severity and respective actions will be taken accordingly. In the video, Mr. Arifin has mentioned pneumonia a few times, and so pneumonia is an infection that inflames the air sac in one or both lungs, causing cough, fever, chills, and difficulty in breathing. So if you refer in the image below, the left image is the diagram to illustrate what is pneumonia. So in normal lung, the alveoli should be filled with air space. However, in lung with the pneumonia, as shown in the X-ray image, the lung is filled with the fluid, so it causes the presence of grey hazy areas at the below part of the lung. Okay, next. Here is the example of the COVID-19, the lung X-ray in COVID-19 patient. The patient is admitted with few diseases associated with COVID-19. The left image is the normal lung, while for the right is the lung of COVID-19 patient. As you can see, the patient has ground glass opacification, which refers to the hazy gray area. This ground glass opacification, you guys can refer to the part which pointed by the arrow. So these gray areas indicate the increased density inside the lung. In normal lung, at the area pointed by the arrow, it should be appear black. So these gray hazy areas, it could be due to the air spaces inside the alveoli is now filled with fluid, as I have mentioned before in pneumonia, or the thickening of the walls of the alveoli itself. Or the third reason, it might be due to the thickening of the lungs itself. So by seeing this image, now we can see that by having image of the X-ray of the COVID patient, we can now see how severe the diseases is. After that, we can now act accordingly. If it is stage 2, for example, then what actions need to be taken by the doctors and the hospital. Next up will be concluded by my friend Zarin.
So you guys already have some idea by far, I hope so, about the X-rays, and hope you already learned a few more important things. But before finishing our webinar, let's conclude some of the important parts just for a review. So, well, first of all, we learned what is X-ray, and it's an imaging device, we all know. Okay, so we also learned about the main components of the X-ray and some of the other smaller components. And at the same time, we learned how the results of the X-rays are judged by the doctors and the radiographers. We also had an interview with a radiographer from the hospital, and we learned there are some restrictions that must be followed during the X-ray by both patient and the doctor. So and we are also learned one of the main thing, which is how the X-ray is playing a very important role during this pandemic, and how it is helping to make the lives of doctors and the patients easier. So I hope you all learned all of these things and you enjoyed it. I hope it was interesting to you. And if you have any question answers now, we will move on to that part. So please let us know if you have any question in the chat box, or maybe you can also just speak to us and we will try to answer all the questions. Thank you.
Assalamualaikum. Assalamualaikum.
Hello?
Hello. Boleh dengar tak?
Yes.
Okey, saya Syafiq Amali dari UiTM. Saya ada dua soalan lah. Boleh tak saya nak tanya?
Yes, sure.
Okey,
Thank you for
kan
the
tadi
question.
dalam slide dia tulis intravenous injected agent or dye tu bagi more clear punya result kan, result X-ray. Okey, based on my experience, kenapa dekat white dia tak inject pun, dia tak bagi melalui IV, dia bagi melalui mostly bagi melalui fluid, minum biasa je. Kenapa? Adakah minum dengan IV mana lebih accurate? Tu soalan pertama saya. Soalan kedua saya, adakah X-ray ni ada yang portable X-ray machine? Tu je soalan saya. Terima kasih.
Hi, thank you for the question. So for the intravenous injection, Your question is, if I were to repeat the which one is more accurate with to inject or to drink, right?
Yes.
So I think it is not about, maybe it is not about accuracy, maybe it is depending on the type of examination, for example, and because I believe maybe some examinations maybe need injection, and some maybe it's sufficient enough by just drinking the substance, the fluid. As for the accuracy, for now, I'm afraid that we cannot give a specific answer. Portable X-ray. I guess for now we have the portable X-ray. But maybe it is depends on the hospital, because maybe it's the more latest technology. So we might hard to be seeing it around in normal clinics, but in hospital you might be seeing one. Okay, I hope that answer you. Thank you.
Okay, thank you.
Hi, I would like to add a few points about the first question. Are you still there? Okay, so you mentioned about the whether IV or drinking is better, right?
Yes.
Well, you have to know the purpose of we inject this contrast agent is because we want to highlight the parts of the body that is not very clear in the X-ray image. For example, the blood vessel, right? So injecting the IV into the blood vessel will make it more clear because it is much like more accurate and bersasar. What is bersasar? You understand, right? Bersasar kepada benda yang kita nak
Dia lebih
highlight tu.
lebih fokus kepada
Berfokus.
satu
Ya,
satu
fokus.
organ tu.
Uh, tu.
Sebab apa saya tanya soalan tu sebab saya curious apa ni bila dekat ward masa saya nak pergi hantar patient pergi X-ray, dia mostly dia bagi air je. Dia tak ada inject ke apa, tak ada. That's why lah, sebab dalam slide you guys buat ni, you guys cakap inject. So macam kenapa dekat hospital dia bagi air, kenapa dekat slide dia inject? Macam tu lah, tu soalan saya.
Oh, drinking pun is another method, tapi usually we would opt for injection. Lagipun we use this contrast agent in fluoroscopy, for example, for a real time movement punya imaging, macam blood vessel dia kan bergerak macam kan, blood. Faham tak?
Okay, faham.
I hope it answers your questions.
Yes, thank you.
Okay.
So we move on to the next question. What is the main component of the X-ray? Except, so which one is not the main component of the X-ray machine? Is it X-ray tube? Is it cooling system? Is it microwave? Or high voltage generator? So which one? Yes, correct. Microwave is not the main component of X-ray. Microwave is usually that we use to heat up our food, so it is not be included as the main component of the X-ray machine. So the main component are the X-ray tube, cooling system, and also the high voltage generator. So let's see who's on the top. Putri is on the top. Next question. So which part of the body is captured by the X-ray machine? So the X-ray image show which part of the body. As you can see here, is it hand? Is it abdomen? Or is it dinosaur skeleton? Or is it knee joint? Which part? Yes, it is correct. It is abdomen. It is not dinosaur skeleton. It is abdomen because the image show the hip bone and also the spine, the backbone. So Putri is still on the top. So what does the dark color indicate for the image that appear on the X-ray film? So what does the dark color indicates? So this is the chest part of the human body. Is it nasi lemak? Is it burger? He just had his breakfast. Yes, it's correct. It is air because air is the low density and it absorbs less radiation from the X-ray machine that expose the radiation. So it is not nasi lemak, it is not bone, it's not burger because bone will appear white on the X-ray film or light green. So next, Diana is on the top now. Next question. So determine which one has high contrast image and which one has the low contrast image. So A image is on the left side and B image is on the right side. So choose which one has the high contrast and low contrast image. Yes, correct. It is A has the high contrast image and B has the low contrast image. So we move on to the last question. Oh no, Snowflakes is on the top and Diana is going to the second place right now. So last question. So which of the following is not the side effect of the X-ray radiation? So which one is not the side effect of radiation? Is it will increase the risk of cancer, or increase the height of patient, or hair loss, or cell mutation? Which one is not the side effect? Yes, it is not the side effect, which is it will not increase the height of patient. It just cause the increase the risk of cancer, hair loss due to the chemotherapy treatment, and also it may cause the cell mutation if it exposed to the high dose of radiation. So let's see who's got third place. Third place goes to Fear. And second place goes to Snowflakes. And the winner for this Kahoot quiz session goes to Diana. Congratulations. So there's run up. Fourth place goes to Putri and fifth place. Oh, I didn't manage to see that. So congratulations to all the winners. So to those who didn't manage to get the top 5, it is okay. Every day is actually a learning process. So before we end our session, all the participants and also my team members, please open up your camera for photo session. So is everyone ready for photo session? Please open up your camera. So if everyone ready, let's go. Okay, 1, 2, 3. Okay, 1, 2, 3. Smile. So the last one, freestyle. 1, 2, 3. Okay.
Okay, Assalamualaikum
So
and good morning. I just want to say thank you very much for the presentation, for the
Okay,
sharing
Doctor.
session. Can you hear?
Yes, we can hear you.
From UTM and also outside UTM, thank you very much for your support to your friends. I think most of them are your friends. Thank you very much. And thank you for spending your time joining us today. Okay, thank you.
Thank you, Doctor. Thank you.
Thank you, Doctor.
Everyone. Thank you, friends.
So, and with that, we have come to
Thanks
the
so
end
much,
of today's
everyone.
session, and I hope you guys learned something new. So, on behalf of the team member, I would like to apologize for any inconvenience that occurred throughout this session, and thank all the audience and the team member who has put a lot of great effort into making this event successful. So, to the participants, we appreciate that you are taking time out of your busy schedule to join us today. And I hope to see you all again in the next time. Thank you and Assalamualaikum. And don't forget to fill up this Menti, this feedback form. Thank you.